Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York iHeartRadio. I'm your host, Xen Sams. Welcome back to the Expert on the Microphone series in the Better, Brighter You segment, brought to you by Cyspera. Today, we're tackling a skincare concern that millions struggle with: hyperpigmentation. Whether it's post-inflammatory marks, melasma, or sun damage, uneven skin tone can be a persistent and frustrating issue. The challenge? Well, many treatments come with risks, from irritation to unwanted side effects like hypopigmentation. That's where cutting edge science is changing the game. Cyspera is one of the most advanced pigment correcting treatments on the market, delivering the power of traditional solutions like hydroquinone without the risks. Backed by rigorous clinical trials, including studies with over 80% of participants with skin of color, it's proving to be a dermatologist's favorite. And speaking of dermatologists, we're thrilled to have Dr. Elyse Love with us today. Right now, she's going to join us. She's a board-certified dermatologist at Gramercy Laser and Medical Dermatology right here in New York City. She specializes in customizing skincare regimens for patients of all backgrounds. Dr. Love also co-hosts the BeautyCurious podcast, where she dives into science-based skincare insights. Today, she's going to join me to chat the hyperpigmentation breakthrough and what your skincare routine is missing. Welcoming now to the show is the amazing Dr. Elyse Love. Welcome to the show, superstar.
Thank you for having me. I'm so excited to talk about one of my favorite topics, hyperpigmentation, or getting rid
Okay.
of hyperpigmentation, really.
Or getting rid of it, right?
Yeah.
And dermatology is one of the most rapidly advancing fields in medicine, but it's also deeply personal. And skincare isn't just about looking good, it's about confidence, self-expression, and overall well-being. What inspired you to specialize in dermatology, and how has your approach evolved over the years to meet all these diverse needs of your patients?
Yeah, I mean, that is exactly what you just said was actually my journey to dermatology. So I always say my journey to dermatology started as a patient. So I suffered with pretty moderate to severe acne for years and years and years. And it's not actually my struggle with acne that led me to dermatology. It's once my skin was clear and I realized the difference in my every other aspect of my life. Once my skin was clear, I realized that I was more outgoing. I realized that, I would raise my hand in class. I wanted to share ideas. I wanted to more participate in society. That I was like, this is amazing. So it's really the quality of life impact of dermatology that led me to go to medical school and eventually become a dermatologist. From the beginning, my training has always been, there's been a focus on that quality of life impact, but also providing culturally competent care and realizing that even if two people need the same medical treatment, you may not approach that medical treatment. You may not approach that conversation about that medical treatment in the same way. And so I think that, as we learn more, we are all evolving, but I'm really grateful that that focus on how do you provide clinically sound and adequate care to a diverse range of patients has always been at the core of my medical practice.
That's such a great perspective. Personalization in skincare is everything. And
Yeah.
it's amazing to hear how you prioritize that in your practice. I love that. Now, let's talk about treating hyperpigmentation in skin of color. So, hyperpigmentation, as we know, is one of the top concerns among dermatology patients, particularly those with darker skin tones. And research shows that over 65% of dermatology visits by Black, Hispanic, and Asian patients involve concerns related to
Yeah.
dark spots and uneven skin tone. Why does hyperpigmentation tend to be more persistent in deeper skin tones? And how does this impact the impact of the treatment decisions?
It's the price that we pay for our beautiful melanin. Throughout life, we're always more prone to hyperpigmentation, and that's because anything that affects the skin, almost anything that affects the skin, will leave a dark spot. So you get one acne pimple, you have a dark spot from it. You get an eczema rash, you get a dark spot from it. And so these things just, these are normal things that are accumulating throughout the week, throughout the month. And then their sun damage can cause hyperpigmentation. We see that with aging and older skin types, and even melasma, which is a condition where the skin, instead of getting a rash, you can actually develop pigmentation. this is more common in darker skin types. And so we get that protection, that little extra protection from the sun. There's like slower rates of aging, but almost anything and everything makes us can potentially cause a dark spot or pigmentation in the skin.
That's fascinating, and it really underscores why a targeted, science-backed approach is so necessary when right? Now let's talk about traditional treatment approaches and their limitations. So when it comes to treating hyperpigmentation, we often hear about topical agents, lasers, and chemical peels, but not all treatments are created equal. Some can actually worsen pigmentation if not used correctly, especially in skin of color. From your perspective, what are the most effective treatment approaches and what factors determine the best choice for a patient?
We know that pigmentation is a 14-step process. And so the more steps that you can interfere with, you're going to have more effective treatment. But we also know that irritation worsens pigmentation. And so I see it all the time where my patients come in and they're trying to do everything and they've actually made their pigmentation worse. And so in terms of the most effective type of pigmentation, I will say hyperpigmentation can be complicated. It depends on how superficial it is. It depends on how like dark the pigmentation is. And it also depends on your skin type, how sensitive your skin is. But one of the really exciting things that's happened over the past 5 years is that we're getting more and more gentle topicals that also are very effective for hyperpigmentation. Because it used to be that you kind of, if you use something like gentle, like a kojic acid, it would do a little something, but not anything particularly magical. And then over here, you have like your retinoids that can be powerful, but can be completely or can be irritating to certain skin types. And so it's nice that now we have things like Cispera that we can add into the mix where it is been shown to be as effective as actually hydroquinone based formulas, but has a much higher tolerability on the skin. And even related to that, there's no risk of over lightening the skin. And so that's
And
always a
that
concern.
was my next question. Okay, let's chat the shift away from hydroquinone and safer alternatives. So for decades, we know that hydroquinone was considered the gold standard for pigment correction, but we now know that long-term use can lead to serious side effects, including skin thinning, acrinosis, and even rebound hyperpigmentation. With newer alternatives like Cispera, how should patients weigh the effectiveness versus safety debate when choosing a pigment correcting treatment?
Yeah, I mean, I think patients always want the safest option. If you're telling me something is equally as effective, but I can use it continuously and not worry about it, I think that's always going to be the option that patients go to. I do think hydroquinone is a great ingredient when used correctly, but it's really only a great option for certain types of pigmentation because I see it often where a patient has gotten it from somewhere else, and they actually will cause like almost like halo effects if they're trying to treat acne marks, where it's almost like you have a little bullseye on your face now because you have the dark spot, and then right around it, it's lighter, and then you have your normal skin. And also, we would never use hydroquinone for longer than 12 weeks. So even if it works for you, it's not a sustainable option that we would then say, oh, we found your hyperpigmentation treatment. Now you can like just, we're done. Like this, let's just continue this. And so it's
Right.
incredible to have things like Cispera and other more gentle, non-bleaching skin
Right.
treatment options that you can use long term and you can feel comfortable that it's going to work both in the moment to help with the dark spots, but then also as a maintenance alternative. So, like for the Cispera regimen, it's daily for probably those first 4 months while you're actively treating pigmentation, but then you can keep it into your routine 2 times a week to maintain because like we said we're always being assaulted with things that can cause pigmentation, and so having that maintenance is going to be necessary.
Thank you for that thorough explanation, which brings me to my next topic. Cispera's unique mechanism, it's a dermatologist preference, and Cispera has been making waves in the derm world because it delivers results comparable to hydroquinone without the risks. And unlike traditional pigment correctors, it's powered by cysteamine, which occurs naturally in human cells. So what makes this cysteamine a game-changing ingredient in the fight against hyperpigmentation, and why do derms trust Cispera as an alternative?
The things that make cysteamine unique is the fact that it can be used long term. the fact that it does not cause any type of skin bleaching. So it can be used consistently and it can be used on the full face. And so this is particularly relevant for people who have patchy melasma or people who have post acne marks. So you may have dark spots that are scattered throughout the face, but it's really hard to spot treat every single one of them. And so you can use it on the whole face without worrying that you're going to lighten the skin tone. And then the third thing is the tolerability. Tolerability is a game changer for treating hyperpigmentation because anything that irritates the skin can potentially make the pigmentation worse. And so I
Right.
think cysteamine is an incredible ingredient, and we're getting more and more of these ingredients coming to market.
Yeah, cysteamine, game changer. It's incredible. So we're talking about a treatment that works in harmony with the skin rather than against it, right? And
Yeah.
that's truly what it's about. And what I want to point out is that I have been using Cyspera
Yeah.
and I don't have any hyperpigmentation or melasma or my skin is good, but now it's even better because I have that brightness, that
It's
natural
bright. Yeah.
glow.
Yeah.
It just brightened me up and without having to use any harsh chemicals. So when I tried it for the first time, the first thing I Googled was, can I use this every day? Even if I don't have any of the telltale signs of what it actually can also cure that other
Yeah.
products on the market don't. And then I was like, wow, this is skincare. This is not just solving problematic skin, right? Whether it's melassa, hyperpigmentation, this is great for just maintenance. So now I want to talk about exactly that, the clinical trials and diversity in dermatology research, which I think is so important and so underrated. A major issue in dermatology research is that many clinical trials have historically excluded patients with skin of color, and this has led to treatments that may not be as effective or safe for darker complexions. Now, Cyspera stands out because its clinical trials included over 80% of participants with skin of color. Big shout out.
Yeah.
How important is this kind of representation in dermatology research? And do you think we're seeing real progress in this area?
Yeah, I think that it's such an important, it's a point, and it's important from both the like disease perspective and the treatment perspective. So an example in terms of disease perspective is that when we look, we know that visible light causes pigmentation in darker skin tones. But it does not cause pigmentation in lighter skin tones. And so if we didn't do that study on every single skin type, we wouldn't have that information. And it's the same for pigment fighting ingredients. We know that some are not as effective on darker skin tones, but also when we get back to the point of irritation. So we know that if you're testing out your formula on a lighter skin tone, you may get some mild irritation, but that may not affect your results, right? Because lighter skin tones are not as prone to post-inflammatory hyperpigmentation. But you may find that if you give that same formula to someone with a darker skin tone, that little bit of inflammation that your product creates may actually inhibit your results. And so I do think the beauty industry is leading. I think, it's a really exciting time for the consumer because more and more beauty brands are doing clinical studies on their products. They're not just saying, oh, like this, we think that this will work. More and more beauty products are doing clinical studies. And I think that the beauty brands understand that the consumer now is demanding that they test these products on them. And so we are seeing this push where more and more brands are including all five skin types, but we definitely have to acknowledge and like give a shout out and support the brands that have been doing it from the beginning.
Amen to that. Now, it's the truth. And we're almost at the end of this incredible segment. I love talking to you because I love talking to experts that make so much sense and that put it into perspective for our audience. And for those struggling with hyperpigmentation, the journey to clear even skin does feel frustrating and overwhelming. And there's a lot of misinformation out there, and not every treatment is a good fit for every skin type. So I love that we had this conversation and we're pointing our audience in the right direction. Now, if you have one piece of advice very quickly you'd give to someone looking to safely and effectively treat that hyperpigmentation, what would it be?
Okay, well, if I had one piece of advice, I would say pigmentation is really complicated. It's even complicated for me as a dermatologist. So if you have the option to go and be seen by a board certified dermatologist and do this journey together. I highly recommend. But even, I will honestly say most of the best pigment fighters are over the counter. So if you are going on this journey alone, there is social media for like some extra board certified advice. But just remember to go low and slow. So more is not more. More is not more when treating hyperpigmentation, because if you do too much, you can worsen your results. So take it slow, be patient, and just know that there are some incredible options that you have that are over the counter.
And look at the clinicals. I always say that.
Yes,
Look at the
yes,
clinicals. Be an informed consumer.
yes.
Well, thank you so much, Dr. Love. This has been such an enlightening conversation. Thank you for breaking down the science behind hyperpigmentation, safe treatment options, and the power of dermatologist-backed innovations like Cyspera. Thank you so much for coming on.
Thank you for having me. This was such a joy.
For those listening, if you're looking for a clinically proven solution to stubborn dark spots, visit Cyspera.com, or you can check them out on Instagram at Cyspera with a Y. And be sure to follow Dr. Elyse Love on social media at Elyse Love MD, and check out her podcast, BeautyCurious, for even more skincare insights. You're listening to A Moment of Zen right here on 710 WR, the voice of New York. That was our expert on the microphone in the Better, Brighter You segment, brought to you by Cyspera. We'll be right back after this.
A Moment of Zen is brought to you by Cyspera. If skin discoloration is making it hard to find your Zen, Cyspera can help. Stubborn pigmentation, dark spots, and uneven skin tone concerns go beyond the surface, affecting both confidence and self-expression. In a sea of skincare choices, Cyspera stands apart. Backed by science and trusted by dermatologists worldwide, Cyspera is powered by the advanced cysteamine isobonic amide complex, delivering clinically proven results and effectively targeting mild to persistent discoloration while restoring the skin's natural glow. Unlike harsh treatments, Cyspera is formulated for all skin types, including sensitive areas, ensuring visible improvements without irritation. Whether pigmentation is a new concern or a long-standing struggle, Cyspera works in harmony with the skin to bring balance, clarity, and renewed confidence. Cyspera is science-driven skincare for confidence that shines. Find your skin zen and restore your glow with Cyspera today by heading to Cyspera.com.